Hi everyone, my name is Carrie Lynch and I am the current PGY1 community-based pharmacy resident with the University of South Carolina College of Pharmacy and Hawthorne Pharmacy in Columbia, South Carolina. And I'm here today to present to you my research entitled Pharmacist Perceptions and Willingness to Initiate COVID-19 Point-of-Care Testing in an Independent Community Pharmacy Setting. The authors of this presentation do not have anything to disclose concerning possible financial or personal relationships. Now, the number of confirmed cases of COVID-19 have continually increased over the past year. And as you can see, as of April 13th, 2021, the number is up to 472,310 confirmed cases in the state of South Carolina alone. And community pharmacists are considered some of the most accessible healthcare providers with the qualifications necessary to provide point-of-care COVID-19 testing for patients in their practice sites. Pharmacists practicing in smaller independent pharmacies, however, must face additional considerations when implementing enhanced services like COVID-19 testing. And in a systematic review by Gubens et al., they emphasize that the lack of widespread offering of point-of-care testing in pharmacies and hesitation to implement can delegitimize efforts in the eyes of other healthcare stakeholders. Now I have my objectives. So from this research, it is 1, to assess pharmacists' attitudes toward point-of-care testing within a pharmacy. 2, determine strategies for providing COVID-19 point-of-care testing to patients. And 3, identify perceived barriers to initiating a COVID-19 point-of-care testing service. Now I have my methodology. 80 pharmacists completed a 44-item survey over a 10-week period. Eligible participants included pharmacists over 18 years of age who read English, maintain an active pharmacist license, and are currently practicing in a community pharmacy setting. The survey was part of a larger study of South Carolina pharmacists, and the study received approval from the University of South Carolina Institutional Review Board. And this poster does contain preliminary results as data collection is still ongoing. Descriptive statistics were used to collect demographic information, and the questions in the 5-point Likert scale formatting were analyzed by calculating the mean within each category pertaining to patient and operations related factors and testing follow-up. Willingness to implement COVID-19 point-of-care testing were analyzed based on the existence of community pharmacy enhanced service networks, or CPSN's, required core services. And you can see these required core services on the figure on this slide. This chart contains respondent and pharmacy demographics. As you can see, the majority of our respondents work in primary care settings like national chains and single independent pharmacies, followed by multi-store independent, then supermarket, and then finally regional chain. The majority of our respondents were pharmacy managers within their practice settings, and the large majority of our respondents, 64 respondents, reported not having an active collaborative practice agreement with a physician. As you can see here, the majority of our patients reported working in primary settings that have been in operation for more than 20 years. So these are very established pharmacies within their communities. And here you can see that the majority of our respondents reported having a PharmD as their highest level of pharmacy training. And then you can see the primary practice hours of operation listed here as well. This graph shows CLIA waiver status across different practice settings. As you can see, there is need to improve CLIA waiver status across all pharmacy settings, but it does seem that independent pharmacies are in the best place in regards to CLIA waiver status alone. This chart displays willingness to implement a COVID-19 point-of-care testing service based on the existence of CPSN core services. As you can see, it is broken down into 3 categories, and each category contained 5-point Likert scale questions within the survey. The first category assessed patient-related factors that can influence service success, like patient interest and need and willingness to pay out-of-pocket cost. The second category looked at factors that can influence the steps for necessary follow-up, like local physician buy-in and pharmacist comfort level in counseling a patient after a positive or negative result. The operations-related category assess the respondent's thoughts on whether he or she believes the staff could handle implementing a new service within the workflow, and if they think that the service would be financially viable. Again, we conducted a Pearson correlation between the pharmacist responses within these categories and the existence of CPSN core services within their practice setting. And based on the p-value, there were statistically significant correlations for the patient-related factors and testing follow-up categories. This figure contains considerations, duty allocations, and courses of action. Based on our pharmacist responses, the most important considerations when implementing this service include staff and patient safety and disruption to existing workflow. And then also based on pharmacist responses, they believe the pharmacy technicians can be utilized for marketing the service, screening and obtaining consent, and for billing procedures, whereas the pharmacist duties would include administering the test to the patient and interpreting the test result. And then they believe the best course of action after a positive COVID-19 test result would be to contact the patient via the telephone and the primary care provider via fax. The limitations are listed here. Due to the small sample size and inclusion of only South Carolina pharmacists, the generalizability of these findings is limited and may not be applicable to community pharmacies in other areas of the United States. Also, as this study collected self-reported attitudes and behaviors, social desirability and recall bias may be a concern. And then finally, individuals who responded to the survey may differ from non-respondents, therefore resulting in non-response bias. And now for conclusions, independent pharmacies seem more equipped to conduct point of care testing when compared to chain pharmacies based on CLIA waiver status alone. However, there is need to improve status across all practice settings. There is a need to develop strategies to implement COVID-19 point of care testing within the pharmacy so as not to interfere with daily workflow, as this is the biggest concern for pharmacists within the study. And then finally, significant correlations were found between enhanced pharmacy status and patient-related and testing follow-up related barriers. Those pharmacies with enhanced services were more likely to report fewer barriers to point-of-care testing implementation. These are the acknowledgements for this research. Thank you for attending this session. If you have any further questions, please feel free to attend my live Q&A. Thank you.